Evening. Welcome to Health is Wealth. This program is presented, ooh, it's cold, by the Chicago chapter of the National Black Nurses Association. I'm Bernetta Pearson. On the phone is Miss Janice Henry. And to my left, and your right, is Miss Pamela Johnson, who is our health policy chairperson. And I asked Pam to come tonight because Pam is very articulate in matters of the Congress of the United States of America and the goings-on of the health, what is a good name for that fiasco? The ongoing drama concerning our health I can't think of a better name, family, but the ongoing drama concerning our health plan and how it was supposed to be. It started out to be. It was promised to be. And it has now eroded into a great big fat mess, for lack of a better word. Now, this affects you. I cannot believe, Pam, how many people I talk to who have no idea what all of this is about, have no idea that it is going to affect them, not only now, but for years to come. And it is the lack of the public on understanding so many things. I'm not even talking about financial and housing. That's another whole mess. But everything that concerns you. And yet these same people, once whatever is passed, and we have to live with it. These are the people who you will see grumbling, mumbling, complaining, protesting. Why do we march and talk and complain after the horse has left the barn? So I asked Miss Pam Johnson here today, and I had to pour her, to get here, because she doesn't like to get on TV and talk about things. But in fact, she's kind of shy. I just thought I'd let you know that. But all those brains up there are not going to waste tonight, because Pam is going to tell us. We're going to start out real quick about the Congress of the United States, the U.S. Senate, the United States Senate, in whose hands this proposed bill is now, and it is projected to be, or wanted to be, done by the end of the year for the president to sign. That is the president's wish. So, real quick, tell us about the Senate and what is the latest little mess going on, a little capsule about this bill.
Well, I don't know how aware people are, but Congress's approval ratings is like in the 30s.
In the tank. In the toilet. Okay.
And this whole debate on healthcare reform is one of the reasons why. It's very difficult to get anything through Congress. Lyndon Johnson once said the only way that you work with Congress is continuously, incessantly, and without stopping. So it's a very slow process due to their rules and their regulations and their protocols and so forth. The bill did pass in the House of Representatives with the public option in there. And what people need to understand, the whole thing with the public option is that it forces the insurance companies to compete for your insurance dollars.
And that's bottom line.
That's the bottom line of how it was going to make health care affordable. During the campaign, when President Obama was campaigning, he was not, his point was that people don't not buy health insurance because they don't want to have health insurance. They don't buy it because it's too expensive. Employers, it's too expensive for employers. We can't be competitive with people overseas who have national health care, like in Germany. They don't have to add $5,000 to a Mercedes for health coverage because they have a national health plan. So the problem with, so it was passed in the House of Representatives, it went to the Senate, and that's where the debate is now. They've all but dropped the public option and trying to get one senator from Connecticut, Senator Lieberman, to vote for the bill because they need the 60 votes to withstand a Republican filibuster of the bill.
And that's what we're trying to get you to understand. We have a caller on the line. We're going to get to in one second. But this is what we want you to understand. People, I listen to the talk shows, and they talk about why doesn't our president do this? Why don't they do that? And he's a chicken, and the Democrats are cowards, et cetera, et cetera. But you gotta have, in order to keep the party of the no, which happens to be the Republican Party, from doing a filibuster, which means to tie the bill up ad infinitum, you have to have the 60 votes of the Democrats in the Senate in order to avoid that. Well, at the moment, the other thing, 59.
Yeah,
they think.
Right. I think the other thing that people have to realize too is that our form of government, we have 3 branches of government. Go back to your civics class. Executive, that's the president and his cabinet, the Congress, the legislative, the ones that pass the laws, and the judiciary, which enforces the laws. And they're all equal, co-equal. Now, it didn't seem like that during Bush's terms, but they are co-equal. And we have checks and balances. That's so that we don't have a dictatorship. And the president has to deal with Congress.
Okay. Hi, caller. Good evening.
Good evening, ladies. But, you know, you're talking about the healthcare system in Chicago. I mean, in the country. But this is the deal. Okay, when you look at such countries such as France or maybe even Canada, they getting ready to go bankrupt because especially in France, they are really taxed out of the wazoo. And part of the problem is this. You know, there are some problems with their healthcare system, and people are concerned, will that be the same in this country? And also, when you talk about terms of employees that have to carry insurance on the employees, when you look at it like this, when you look at one part of it, you're going to have employees not going to carry it because it may be cheaper to be penalized for not having health care on their employees.
Well, let me say this to you. Just like we pay for that car insurance and the uninsured motorist and pay that money, which is a lot too much for a lot of us, if we do not have that, we will pay for these people anyway.
I understand what you're saying.
Yes.
But part of the problem is this, okay? We may have people waiting long periods of time to see a doctor. We may not have the specialists like we have in this, like we have specialists here. We may not have specialists be going into those fields of work because why? It may not be paying.
But let me ask you something without debating it.
Am I wrong?
What I want to ask you,
issues?
let me ask you this. The purpose of the program tonight is that, and we're having a really good debate, but I want to make sure that other people besides you, myself, and Miss Pamela Johnson understand the process. And then everybody's entitled to have their opinion like you're expressing tonight.
That's the reason why we need to have debate. And before, that's the reason why we need to work out the bugs, the Kents, and all that. Yeah. Because when we look at other countries and their examples, then we give people a reason to oppose universal health care.
But I think a lot of that is myth. A lot of that is myth. Okay, well, you need to really look at is health care and how in other countries that primary health care is the whole focus of their healthcare systems, and that is a right-wing myth that, you know, all these long waiting periods and all. Yes, it is. Because if you look at your history, I'm sorry, caller, can I just make this point and then I'll let you make your point? Okay. When you look at your history, all of the advances in healthcare were not made by all these specialists and so forth. The advances in healthcare that saved millions of lives was public health, sanitation, vaccinations. Those are clean water. Those are the things that saved lives and stopped people from dying. What we have today, the illnesses that kill people are lifestyle illnesses. Heart disease, high blood pressure, diabetes. Those are things that we as individuals have to change in ourselves, and we have to have a health system that focuses on prevention to prevent those illnesses in the first place.
But Miss, research costs money.
But it doesn't matter what the three of us think. If we don't have people understand what's going on in that Congress, we can have the best point in the world, but we're leaving it in the hands of 60 Democrats, if that's the way we're voting, that we're not going to influence one way or the other because we're not saying anything.
A new type of drug that be developed, it costs money and it costs research. Will you disagree with that?
But here's the point. If you live a healthy lifestyle, if you have a healthcare system that focuses on prevention, okay, instead of spending $150,000 for a newborn that was born prematurely, instead of spending that, you spend less than an eighth of that providing women with prenatal care.
And we're going to let some other callers get on, and then you can call us back.
Some things are already predisposed.
I thank you.